Yeah, they love it up there. Have you run into them yet?
No.
They're always down at the Thompson House.
Oh yeah, we haven't eaten there yet. It's on the to-do list, but
What's the other one? The cider?
White Mountain Cider House.
Yes, yeah.
Yeah, that's a nice place.
Yeah, I like that. That's a neat place. Great area. Is Black open?
No, Black was actually, and I think it was open. I think it was open. I saw a few people skiing down, at the end of one of the days. Certainly wasn't very active because there wasn't much snow there.
Yeah.
But I think they must have at least had one chair running.
They don't have a triple. They're all double chairs and singles,
Yeah.
right?
Yeah,
Still have a rope though?
I don't think so. All right. So Mark's here, Tony's here.
I'm here too.
All right, I see Deb's here, so we can get started. The joint meeting of the Board of Selectmen and Board of Health is now in session at 6:30 on January 5th, 2022. The first item on the agenda is a coronavirus update. Do you want to start that off, Deb?
I will, and then John, I'm sure you'll have your piece to add. So, similar to what you've heard on the news for the last 2 weeks, Nahant is following the trend, and we have been inundated with new cases. Our latest testing data, which came in tonight actually, says from 12/19 to January 1st, we had 580 residents tested and 76 are positive. So our numbers have jumped dramatically. Today alone, I think we had probably 14 new cases that just came, and they're still coming in tonight. Just to show you the comparison to last year in December, we had 50 total cases, and this year we ended up with 79. And already for January, which is only, what is today, January 5th, we already have 17 cases. So it's this new virus, the Omicron virus, is spreading very, very quickly, very, very easily. But the very good news about it is, and most of our patients in Nahant that have tested positive have all been vaccinated. Many of them have been boosted, so that these people, when they have these breakthrough cases, are not getting really sick. So that is the benefit, and that is the good news that we have from the boosters and the vaccinations. Unfortunately, the Jesmond has had an outbreak. They currently have 11 residents that are positive and 12 staff members. And we did unfortunately have one death from a resident at the Jesmond. So that's the sad news. The latest vaccine data for the town, we have a great vaccination rate, but right now, starting last week, we were able to get some booster information, because now to be considered fully vaccinated, your prior to vaccines don't really matter. It's all about being boosted, to be protected and to be exempt from any quarantine. So right now, and don't forget the 5 to 15-year-old groups, are still in the process of getting their second vaccine, so they're not in the booster category. But our 16 to 19-year-olds, this was as of December 30th, 28% of them have had their booster. The 20 to 29-year-olds, 30% of them. 30 to 49, 39%. 50 to 64-year-olds, 53%. And here's where it gets really good. 65 to 74-year-olds, 76% have received their boosters, and 75 plus, 70%. So I think, I think we're doing a great job getting boosters for everyone. On the younger population, we have the young kids are starting to get vaccinated. We had many children from the Johnson School that attended both of the town vaccine clinics and also have been going to their pediatricians. So we have 98 of them have received a vaccine. So there's 166 5 to 11-year-olds in our community. And in the 12 to 15-year-old group, we have 85 of them out of 98 that are fully vaccinated. So I think our residents are doing a great job getting themselves and their children vaccinated. We continue to see Nahant residents at our clinics that we do twice a week at Lynn City Hall, every Monday and Friday. This Friday's clinic has been canceled because of the impending snow forecast. But other than that, it's every Monday, 4 to 7 p.m. and every Friday, 9 to 11:30 p.m. a.m. And I have been at those clinics and I have seen Nahant residents coming in for their boosters and their vaccines, which is great. So
Hey,
it's,
Deb, how did the school staff and teachers test out?
so the school right now, it has an influx of positive COVID cases, not even from their pool testing, which was just done yesterday. So we'll get the results of the pool testing tomorrow. But when kids came back on Monday, after the long vacation period, kids were testing positive. Now, these numbers that I give you here are only the numbers that come in through the state. Right now in Nahant, many of the kids in school who are positive have all been home tested. So those results do not come through to me through the state. They come to me through Cheryl Delicio, the school nurse. So we have been meeting every single day to keep up with the influx that she has right now from all of the home testing. The other very interesting piece is that, as you probably know, CDC and DPH have changed the guidelines, which changed all of the isolation from 10 days to 5 days, which made it much more complicated and confusing for all of the healthcare officials, as well as the parents and people that we're calling now with the COVID guidelines. So it was a big meeting yesterday. John was part of it as well, with the North Shore Collaborative of health agents and public health nurses, requesting that DPH answer some of our questions and clarify a lot of this information that we're trying to keep up with, and to tell the people that we're calling with the correct information, when a lot of it doesn't seem to be making a lot of sense right now. So it's just really crazy right now. And the best thing we can do is to keep vaccinating people. That is the best benefit. Like I said, if you're vaccinated, you're not likely to get as sick or hospitalized as those that are not vaccinated. John, do you want to add anything to that?
You're muted, John. John, you're muted.
There we go.
Yep.
So we need to continue to emphasize the importance of testing, and testing sites continue to be available to Nahant residents in Lynn. If you go to the City of Lynn website and click on their testing section, you'll get the several locations where testing is being conducted, and links to be able to set up your appointment. There are walk-ins taken at a couple of the sites, but it's always recommended to get an appointment. And turnaround time is excellent. Last week I went to the one off the Linway on Blossom Street Extension, and 10 hours after the sample was taken, I got the results. It was negative, but the point is that a 10-hour turnaround is pretty excellent. So I guess that's all I have at this point. Oh,
Hey, John,
I want to add that Deb and I are in touch with our colleagues on the North Shore, and as the cases spike in Nahant, you can imagine there's proportional spike in the other communities around us, and the staff is in dire straits trying to keep up with the increases in cases and the contact tracing, and it's a very serious situation where people are looking to the local Board of Health for direction, sometimes being sent to us for that direction, and we go to the state protocols, and sometimes we are just not finding what we need. So a bunch of us, about 8 of us representing our 8 municipalities, signed a list of questions going to the state level, looking for answers to give us a firmer foundation upon which to give people direction. And we've been promised to have a response by this coming Monday. So our fingers are crossed, and we're hoping that that we can get something that we can rely on, and it's not every public health official for himself trying to do the best from one case to the next. So Deb and I are trying as hard as we can to make sure that what we are advising folks is consistent with our colleagues on the North Shore, and as well as being compliant with what's coming from the state and federal levels. Thank you.
Hey, John, it's Mark. This is a question for you, Tony, and Deb. I've noticed that a lot of the surrounding communities have adopted indoor mask mandate, and I know that we haven't yet, and wanted to know what your opinion is on that, and whether it's something we should be looking into.
Well, we are looking into it. In fact, I sent Tony and Deb a list of 13 of our nearby communities that have mask mandates in place. And my comment above that list was that, like snowflakes, no two are the same. And that's because we are all left to craft our own mandates and advisories locally. So we're going to be reviewing those mandates and advisories from those communities, and try and come up with the best that we can for the town of Nahant.
Right, and Mark, I had actually contacted Tony yesterday after the meeting that we had with the North Shore Collaborative, and suggested to him that we do get on board with the mask mandate. And because because we look like, John, you can concur that of all of our neighboring communities, we're the only ones that don't have a mask mandate. And I think that with this, we're a small town, but our numbers are crazy right now. And I think that's just one more way we can help to, I know we can't stop the spread anymore. That term has come and gone. That is not possible, but I think it is a measure that we can take to help mitigate it at some point. So I don't know. I talked to Tony earlier tonight. I'm not sure why he's not on now, but I know he wanted to talk.
I'm
about
here.
that.
Tony's
hi,
on, and I've talked to Tony, a couple times over the last couple of days, and he's conveyed the same message from John and you, Deb. And, it's clear the numbers are exploding exponentially, literally exponentially. And, I, for one, think we need to do a mask mandate in all public places, indoor public spaces, as quickly as we possibly can. I think it's, I'm tired of wearing a mask. I'm sure most people are. And, I'm certainly not one that wants government to interfere with our personal lives, but this is an exceptional situation. And, December 1st, around December 1st was the first time we ever heard of Omicron, and now it's 95% of the cases, and they're exploding. And as inconvenient as it may seem, I think we got to do everything we can. People might not be getting as sick on average, but even just the disruption of it all, if a couple of our police officers come down and can't go to work and need to quarantine, or a couple of our teachers, and I don't know what the supply of substitutes is, but I'm sure it's quite low now. So we have to. What's that? One? Okay, yeah.
One.
And as you pointed out, Deb, the numbers that you reported, as shocking as they are, I'm sure are an under-reporting, because
Right.
I know of people that take, at-home tests. They test, they feel kind of crappy. They take at-home test and they self-quarantine, and that's as far as it goes. So I know the numbers are really worse than the shocking numbers you reported. So this might fall under new business, but maybe we can take things out of sequence and talk about how we can get a mandate in place.
Why don't I do this, Mr. Chairman? Why don't I make a motion that we ask the town administrator to meet with Deb and John, and to adopt develop a policy for indoor mask, and convene a meeting with the Board of Health ASAP.
I'll second that.
Dan Script, do we need the 48-hour notice if we were to approve such a mandate, or can we vote now to? What's your advice on the approach for that?
Given the situation we're in, you can definitely vote on this tonight, especially Deb's input, where this information just came out tonight. Hey, there's no room to wait. There's no time to wait. I recommend, and I am more than happy to defend this to the AG's office, should it ever get there, which I doubt it ever will.
So while we're in discussion on that motion, I'm happy to work with John and Deb to fine tune the language of such a policy. I think there's a few elements that we all in individual conversations with each of the selectmen and with Deb and John that we're all in favor of. Obviously, starting with any indoor space that's open to the public requiring the wearing of a mask. I'd also like to include some language in there regarding signage, which we can provide to our businesses and make available on our website. I'd also, I think another piece of it that I've talked with John about is, on when we did this a year ago, we kind of overlooked, issues with enforcement that we later experienced. And I'd like to offer our local businesses either some type of procedure to report on a weekly basis, or have John's phone number to reach out to should they have like a repeat offender or a repeat issue, that the town can come in and kind of provide them assistance on the enforcement of this policy instead of just leaving it all up to them. So I'd like to add some language on that as well. If the Board of Health so agrees.
I think that makes a lot of sense.
And how, Dan, should I withdraw my motion, and can we approve a mask mandate with directives to follow or something like that? Maybe you'd give us a motion that we could vote on.
Yeah, in this case, I have no problem with voting on the mask mandate. There are rules, of course, regarding 48 hours, but as Tony and I talked about earlier, that only includes topics that the chair would reasonably anticipate would be discussed at the public meeting, such as this meeting. But in a situation where we're just getting information almost in real time, we're in solid ground to take a vote, not only to set a policy, but to actually issue a mandate.
Dan, could the Board of Selectmen motion to approve a mandate to go into place as of Friday, December 7th, and for myself to, draft the particulars with those criteria included
It
that I
would be
mentioned?
Yes, it would be the Board of Selectmen acting as the Board of Health.
Okay,
Yeah.
and Mr. Chairman, I'll withdraw my original motion, and I'll make a new motion to adopt a mask mandate for the town of Nahant with conditions to be determined by the town administrator.
Second,
Any more discussion or any discussion?
I will draft that up and send it over to you, and I will, my goal will be to, discuss it with the open businesses or indoor public spaces ahead of Friday, and that we'll get signage out to them by Friday and have it in place as of Friday. And essentially, I won't put an end date on it. We'll just, when we get to a point where we feel like the cases have decreased and we're kind of coming out of this surge, we can take another vote.
That sounds good to me.
Does that sound good, Deb and John?
Sounds great, Tony.
Sure.
Yeah, certainly it would be definitely good to have it in place at some point Friday. Before people go out Friday night and so on.
Yeah, ahead of the weekend.
Yeah. And I think you've had some conversations with some of the local businesses, right? So it won't come as a shock. Right, Tony?
No, I agree. I don't think it will.
And as Deb pointed out, currently we're the only town in the local area without a local mask mandate. So we're certainly not sticking our neck out here. So any other discussion on the motion? Hearing and seeing none, roll call vote.
Gene Canty, aye.
Mark Cullen and I.
Josh Antrim, aye. Thank you.
Hey,
Mr.
before we go off the subject, Josh, Tony and I had a discussion this week about testing, and I was asking about the possibilities of renewing the testing that we used to have at the church here in town. I know it's been made very acceptable to everybody to go out of town, but with a 40% or more population over 60, it seems like it would be a fair thing to request doing some testing here. Tony came up with a better idea, and that was to do a mail-out kit to everybody in town. And I don't know where you are with that, Tony, but I just thought I'd bring it up so we could perhaps discuss it.
Sure. So as many people know, the governor announced last week, a couple weeks ago, a home test kit initiative that originally the state secured 1 million or 2 million home test kits and distributed those to critical communities. We weren't one of those critical communities. And So we did not, receive any on that first phase of the initiative. However, the state also conducted a RFP process and established a state contract list with manufacturers for municipalities, school districts, public entities to purchase from. So what we're doing is, as are many other communities that, didn't fall under that critical community category, are reaching out to these different manufacturers to figure out, how we can purchase them using our federal American Recovery Act funds, and figuring out which ones we want and how many and how to distribute them. So we've reached out to a few different manufacturers. They are inundated with Massachusetts clients right now. As I mentioned, I wouldn't be surprised if that ends up being headlines at some point soon, where, a lot of these home test kits are being shipped, to Massachusetts because of the swift action by Governor Baker. So we're actively pursuing it. Basically, we're looking, our ideal, there are all different types of home test kits. The ideal test kit that we're searching for are rapid test kits that have 2 tests in a box. And the manufacturers that responded to the state RFP, some that fit that category, have a minimum order that's, way higher than we would need, or some of them meet our needs, but they all are shipped based on either pallet size. And so we're basically just trying to find the sweet spot of, a manufacturer that has inventory that we don't, need to buy way more than we really need right now, and is, 2 in a box and a rapid test kit. So we've been on the phone nonstop. We've been getting a ton of leads through the school, the library, the public health officials, MAPC, and we're trying to put an order in as soon as possible. And if we get that order, distribution, we'd have to figure out how we're going to handle distribution, whether that be like a drive-through pickup, or have them available at the town hall, or, we'll have to, first I want to secure them before we figure out the distribution side. But obviously an important factor that is equity. So making sure that, every resident gets the same amount. I don't have like a time frame or anything right now, but that's where we are with that process.
Well, thanks for jumping all over that, Tony.
Yeah, I mean, the critical thing is we got to get them on order and know when we're going to have them.
And then I think,
as quick as you can.
And it's not just me, John, Sharon at the library, Tony P over at the school, Deb, everybody it's not just me. We have a team going after this. So it's a group of us. And then I think the other part is, with that distribution comes a little bit of education. I have a comment in the chat actually about what the protocol would be for home tests, and, where do you report them and that sort of stuff. So along with the distribution, we'd want to have some type of information card or some sort to hand out to residents. I think the home tests are good, but you really should hold on to them until, you absolutely need to use them, and you use them as like a initial test before you go and get a PCR. So let's say you can't get a PCR for a couple days, take the home test, immediately, but you still should follow up with a real PCR test. So, and then if it's positive, what do you do? I heard from one of our local business owners that the Restaurant Association actually came out with a really good flow chart as far as protocol goes, because so many people are, you know, are you fully vaccinated? Are you half vaccinated? Are you a first responder? You know, what, you know, if you test positive on a home test, if you test positive on a rapid test, you know, what is your next step and what's the protocol? And I heard they came out with a really good flow chart for that. So I'm on the lookout for that. And if it's good, I'd like to share it too, because I think that's a common question. I don't know, Deb, if you get a lot of that, but I'm sure you do. So we're going to keep working on it, and we'll keep you guys in the loop as we make progress.
All right, sounds good. I mean, I think the key thing obviously is just getting them on order, and we can figure out the details of the distribution. And I know you know all this, but you know,
Yeah.
we can figure out the details of distribution and, you know, all the protocols and all that stuff. But I'll feel a lot better once they're on order and we know when they're going to be here.
Yeah.
I'll point out for anybody that's listening that the Nahant.org website, the COVID link, that page has been updated in the last day. Lot more, I'll call it a little more user friendly. So there's some direct links to testing sites as opposed to having to use the mass.gov thing. You still can, but I think it's more user friendly. I know I had a test done at the North Shore Community College about a week ago, and it was a short wait, you know, very convenient, you know, quarter mile from the end of the causeway. So I'd recommend that place.
Hey, where is Project Beacon?
It's where like the ferry terminal is off the Linway.
Okay, yeah.
Blossom Street.
Blossom Street, yeah. Yeah, thank you for mentioning that, Mr. Chairman. So we originally, when the pandemic first hit, we created a website, nahantcovid19.com. Since then, we've created a new nahant.org website. So in the last week, we've transferred a lot of the information from the old covid19.com page onto our nahant.org page, where everybody, you know, is like going for information. So use that, go to nahant.org. There's a COVID-19 button on the left side. It brings you to a page. There's three different links for local testing opportunities. There's 3 different links for local vaccine opportunities. And then if all of those are, you know, full and you can't get an appointment on those, there's the state links for, you know, to go beyond that, vaxfinder.com or
You want to share your screen if you have that open? I have it open too, if that helps. Just so people can see what it looks like and
sure
links that you're referencing and so on.
So if you're at the home page, this is nahant.org. If you're at the home page, click on COVID-19 on the left. It'll bring you to this page here. This data at the top is it needs to be updated. It's the most recent last 2-week snapshot, a number of cases. This next section here is what I was saying is these 3, Lynn Community Health Center, Lynn North Shore Community College, and Lynn City Hall, are great local options that we've partnered with, that we've all had experience with for vaccine. These 3 on the right are great local options for testing. Lynn Community Health, North Shore Community College, and Project Beacon. You know, for Nahant residents, I recommend, you know, if you're looking for a test, try these 3 links first. If you can't find any thing on those 3, if you scroll down to the next section, you can click on mass.gov testing locations. It'll bring you to this website here. And you enter in your zip code, 01908. And all these different, you know, local options pop up. A lot of Walgreens, a lot of CVS, a lot of Rite Aid, you know, a lot of different options. So, and then we have, you know, our other recent updates, press information and whatnot here on the bottom. So much improved from before and in the common location.
All right. Thanks for that. Any other COVID topics before we move on to?
Did we talk about Council on Aging?
Oh, no, we didn't. Do you want to go ahead and?
Yeah, so as of starting tomorrow, the Council on Aging will no longer be doing indoor lunches. They will be switching back to their delivery lunch service that they incorporated when the pandemic first had hit. Doing that because of the recent surge. And I think it's a great idea. I think they're making a safe decision there. So there won't be any more indoor lunches or exercise classes or anything with Council on Aging moving forward until further notice.
Great.
It's good that, how do people sign up for the delivery or is the Council on Aging folks reaching out to people asking?
They have a call list, so like they're you know, standard 30 to 40 folks who are involved there. They're in touch with, but if you haven't, you know, been involved with the Council on Aging in the past, just call the COA number. I gotta look that up. Uh, 781-581-0088, and follow the prompts for Council on Aging. And someone in that department will take down your information and get you signed up. 581-0088.
All right, good. All right, I think we can move on to opening comments now. Some standard announcements here. Christmas tree curbside pickup will be offered Monday through Friday until January 14th, 2022. Remove all lights, ornaments, garland, and stands. Trees cannot be in plastic bags. Holiday wreaths, roping, and garland are not eligible for pickup or drop off. I did notice one of my neighbors had some garland out there that wasn't getting picked up, so that's not eligible to be picked up. Tomorrow night, there'll be a Christmas tree bonfire at Bailey's Hill, Thursday, January 6th, 2022 at 6:00 p.m. So I think the bunch of Christmas trees are already there, and we'll have a big bonfire tomorrow night. Other trees will also be used on an experimental basis at Doggy Beach for some dune building in an area where the dune is damaged. So that's where the other trees that don't get burned tomorrow night, or one of the places trees will be used that don't get burned tomorrow night. Winter parking ban. All vehicles must be parked off the street during the hours of 12 a.m. to 6 a.m. from December 21st, 2021 to March 20th, 2022. Town Hall will be closed on Monday, January 17th, 2022 in observance of Martin Luther King Day. Nahant is seeking snowplow drivers. Contact Mary Lowe at 781-581-0026 or mlowe@nahant.org for more information. MLOWE@nahant.org for more information.
What are they paying?
I don't know. You know, Tony?
I'm interested.
The rate I think is, I want to say it's 75, but you know, I got to double check. It depends on the size truck you have. The insurance requirement is pretty high, so you have to provide a high pay rate to make it worth somebody's, time to get involved. So,
Yeah, I saw the flashing light for Lynn was advertising for drivers, and I was surprised how high the rate is. So, but I hadn't thought about the insurance side.
well, a plug for Nahant, plow drivers, Lynn's rate might be a little bit higher than us, but we provide more hours. We're out there plowing throughout the entire storm. Lynn waits till the last snowfall, this last snowflake drop. So
Yeah. Anyway, that's an opportunity for someone who wants to make some extra money.
Yeah.
Gene or Mark, do you have any other opening comments?
No, not right now. I've got some stuff, but I wanted to wait and chat with Tony about it before we bring it to the board.
All right. Do you have any?
I just have a few things on ongoing business. I'll address it there.
All right, and I don't have anything more than that. So we'll move on to new business. We have an Arbor Day Proclamation. I guess I can read that. This is the Tree City, USA official proclamation. Whereas in 1872, the Nebraska Board of Agriculture established a special day to be set aside for the planting of trees. And whereas this holiday, called Arbor Day, was first observed with the planting of more than 1 million trees in Nebraska. And whereas Arbor Day is now observed throughout the nation and the world. And whereas trees can be a solution to combating climate change by reducing the erosion of our precious topsoils by wind and water, cutting heating and cooling costs, moderating the temperature, cleaning the air, producing life-giving oxygen, and providing habitat for wildlife. And whereas trees are a renewable resource, giving us paper, wood for our homes, fuel for our fires, and countless other wood products. And whereas trees in our city increase property values, enhance the economic vitality of business areas, and beautify our community. And whereas trees, wherever they are planted, are a source of joy and spiritual renewer. Now, therefore, I, Joshua Antrim, Chairman, Nahant Board of Selectmen, April 29th, I, Joshua Antrim, Chairman, Nahant Board of Selectmen, do hereby proclaim April 29th, 2022 as Arbor Day in the town of Nahant, and urge all citizens to celebrate Arbor Day and support efforts to protect our trees and woodlands. And further, I urge all citizens to plant trees to gladden the heart and promote the well-being of this and future generations. Dated today. Chairman, the Nahant Board of Selectmen. That is our Arbor Day proclamation. We need to have, we have some meeting minutes to approve.
Somewhat,
Meeting minutes, do we have a motion on that?
yeah.
Okay, I move that the Nahant Board of Selectmen vote to approve the Board of Selectmen meeting minutes from November 3rd, 2021 and November 17th, 2021.
Second,
Any discussion? Hearing and seeing none, roll call vote.
Gene Canty, aye.
Mark Cullen, aye.
Josh Antrim, aye. Ongoing business. Let's see. Oops.
A couple of things, if I could. We talked about, we did last year, we set up the reviews for Tony and et cetera, but we talked about doing the department heads in January, or at least trying to start them in January. And the other was goals for 2022, just throwing it out there as a thought starter for the next couple of meetings.
Yep, that's good.
You know, I would think that Tony would do the department heads. We do Tony, right?
Yep.
Okay.
Oh, I wasn't intending to do the department heads.
No, I'm not. I don't intend to do. I just wanted to make that clear.
Yes, I appreciate that. It's a good point though, because I like to incorporate, at least one of the couple, 2 or 3 goals that I have for each department head, at least one of them be, filtered down through from your goals for me. I like it to
Yeah.
be associated. So, it's a good point. If we could, start thinking about that. Did we do it on the calendar year or did we do it on the fiscal year?
Calendar.
So then I think, yeah, we should start thinking about them.
Yeah, we it wound up being, I think April 4th is when we finalized your review and goals. I think everything was written in March. So if that's acceptable,
Yeah.
we'll continue with that schedule. Also, the last few meetings, we've gone through all the town meeting articles from 2021's annual town meeting, make sure those all the votes are being acted upon and getting the status and all that stuff. The one thing we didn't go through is all the CPC articles. There are quite a few of them. I think there were 21. So we should go through those and get a status on all those approved CPC projects. Let's try to do that on our January 19th meeting. I'd like to talk to Lynn Spencer, chair of the CPC committee, and kind of get a preview before we go through it in the open session meeting. But we should go through those as well to see how we're doing there. Also, I'd like to remind everybody that I believe the end of January, maybe January 28th, is when all applications for new CPC funded projects need to be submitted. So keep that in mind. I know we have some interest from various organizations for applications, but anyone can make an application. So if you have an idea that falls into one of those categories: historic preservation, public housing, open space and recreation, feel free to put an application together.
Mr. Chairman, I only have a few things. I know that that the town administrator is working on developing a scope to look for consultants for a housing production plan.
Yeah.
And in thinking of that, I thought it would be good to have the housing authority, members of the housing authority, join us in that discussion. And I asked Tony to invite them to our next meeting to begin a preliminary discussion on what that housing plan is going to be, and how we can collaborate with the housing authority.
Yeah, that's a good idea.
Okay. And I think Tony has reached out to the chair of the housing authority, and hopefully we can have a joint meeting at our next meeting.
Yeah, I have. I sent him an email, spoke with our liaison at MAPC. And they're looking to have a follow-up conversation. I don't know if one of you selectmen want to be part of that, to talk about, what the scope would look like. And then they can provide us a estimated cost, to which will help inform, the grant application that we put in through CPC by the end of the month.
Yeah. What, do you know when that might happen, Tony?
I haven't scheduled it yet. I talked to him this week. So whatever, if you want to be the one to be in that conversation, Mark, I can work with you and your schedule to get it on the calendar.
Yeah, is that okay with you, Mr. Chairman?
Yes. Yep. That'd be great.
I think any day, Tony, except for Tuesdays and Thursdays.
Okay.
Any other ongoing business topics?
Yeah, if I could, we got a letter from the planning board on an Army Corps. I'm sure we all read it, but as if I read this correctly, it looks like they want to meet with the selectmen as well. So I don't know, it looks like the contact for that is Patrick O'Reilly.
Mhm.
Yeah,
And-
Gene, I did receive a copy. I haven't talked to either you or Josh about it because of the open meeting law. I did respond personally to Pat O'Reilly with some of my thoughts, and I suggested that we meet with the planning board in open public session to discuss
Great.
it.
Excellent, thanks.
All right, anything else, Gene?
No, I think I've exhausted that.
All
Oh,
right.
yeah, the RNAV.
Oh, right, yeah.
Now we get, you know, that just to make this as simple as I can, the difference in watching this every single night out my back deck is that 1/2 mile would be such a relief for the town of Little Nahant, for Little Nahant. Because they come directly down over Little Nahant, almost 30, 40 at a clip every other night, if not every night. And I can't understand why they can't do that over the halfway house and relieve these people of this noise issue. It doesn't, Dan, you must be able to respond to that in some way.
Are you talking about the landing aircraft?
Yes,
Well, if, like I said, if we've talked about this, the RNAV is what they call an instrument approach procedure. What you're probably talking about are planes that are coming in the visual.
yes.
And that has nothing to do with the RNAV study that you were thinking. This would boil down to what they call noise abatement procedures. And that's a whole different ball of wax than what we've been fighting already.
But not every pilot in every plane can make the decision to go over Little Nahant. It's
No, that's-
almost a perfect landing.
That's air traffic pretty much telling them, giving them a vector, and they're following it.
Yeah, so it's separate from the RNAV issue, right, Dan? Sort of.
Apples and
separate
oranges.
issues.
Apples and oranges.
Yeah. On the subject of the RNAV plan, for those that might not have heard at our last meeting, we joined forces with Swampscott and I think Lynn, maybe Marblehead and Salem, I'm not sure, Tony, and put in a joint request for a year-long study of this thing. And I know, Dan, you and I talked briefly today about how that might unfold. Maybe you could explain that for people.
Sure. Tony stepped up and was able to take some time in that meeting and plead the case of Nahant, and it was echoed by our friends over in Swampscott and Lynn. And what was originally a motion to, I want to say, to accept the recommendation was modified to be a motion to study the process for a year under certain circumstances, not at night. I think summertime there were some restrictions too. And that was actually accepted by the Massport CAC, which is really basically a subcommittee, if you will, of the Massport entity. So now what happens is after the motion was passed, it goes to Massport, the primary Massport board. They have not yet met since that CAC meeting. And I just was checking the schedule about 15 minutes ago. And there's nothing yet scheduled for January, though I expect it to be somewhere in the third week, where they will take up this same issue, likely rubber stamp the CAC's motion and vote, and then send it off to the FAA, who will do what they want with it, but more than likely accept the Massport recommendation.
Now, well, thanks for that update, but on what's actually a separate subject, which was really what Gene's talking about, what's the best approach? I mean, I think the best approach is when we see something that's aircraft that's not where it ought to be currently, to lodge a noise complaint. Is anything to add to that, Dan?
No, it's fun. The terminology, not where it's supposed to be. There really is no area where they're not supposed to be. As long as they're being cleared by the tower, they can be pretty much anywhere. So what the best the town can hope for is to complain about the noise and hopefully get procedures put in place where the airport itself sets up its own rules and says, well, you can't fly, within this sort of vector setting, right? You can't fly within here. And hopefully that would lead to something, but that is something different than the approaches. But to your point, Josh, yes, the best way would just to be a cog in the wheel in complaining about these things, as Gene was mentioning earlier. And there's a Facebook post somewhere too about, actually you sent it, Josh, about the similar issue, that Alaskan Airlines thing. Back in
Yeah,
October.
there's a resident in town who's been complaining, filing a complaint since October. And I just got a copy of it today. They sent her a boilerplate letter. It's 4 pages long. And it's just talking about everything they've done since October of, I think it was 2002, which is quite frankly, nothing. And it's a shame that somebody has to go through all that to get that back. And then Josh, you sent me something on a tracker, an airline tracker, and I think it came from the same resident.
Yeah, actually, Dan sent me that
Oh,
link.
Dan, okay.
Yeah, I thought it was interesting anyway. Doesn't necessarily help us stop the noise, but it would help potentially to identify the aircraft that you think is too close or, cause for your complaint, basically.
Landing on your house.
Yeah.
But we've got to stick with it. I applaud you guys for working on it, but we've got to stick with it and see if we can get some sort of resolve on this, even if it takes a year.
Yeah. Let's see. All right, any other ongoing business? Next item on the agenda is preserving East Point. Just following up on our late December meeting. There is a hearing on January 19th, and we also have a Board of Selectmen meeting that night. So I'll arrange to have our attorney, town council on the line for the Board of Selectmen meeting and have them give us an update on the status of the various suits at our next meeting. Gene or Mark, have anything else on preserving East Point?
No, I don't.
Nothing here.
All right, next item is the town administrator's report. Tony?
Thank you, Mr. Chairman. So I apologize that comments weren't in your opening comments. I know all three of you are probably going to want to say a couple words here. Since our last meeting, there's a fire in town, and we had a police officer, Gino Spelta, firefighters, Frank Papalato and Matt Canty, first responders to the scene, and they saved the lives of 2 Nahant residents who are in the hospital, and one is, I believe, maybe out of the hospital now, and the other's still there recovering. But like a tremendous act of heroism by those 3 first responders of our town. And I can't say enough about how proud I am of them, and what they did and how quickly they applied their training and gave these 2 residents the opportunity to survive this horrific event. And we will be having a more formal ceremony of recognition for them. And the neighbor of this home, actually, who called 911, helped Officer Spelta with a ladder and a hose and really assisted him tremendously, in his efforts, his initial efforts too. So we'll be recognizing her as well. But I just wanted to take a minute, and it should have been in your opening comments. And I know there was we were going to do it tonight, but we're going to do it another day. So I just wanted to take an opportunity to recognize them and their efforts, because, truly true heroes, in my opinion.
No doubt.
Yeah, that's pretty incredible to literally save the lives of two people. So, yeah, we'll have a more formal recognition of their efforts soon, probably at the next meeting, I guess. But anyway, yeah, thanks for remembering to bring that up, Tony.
Hey, Tony, there was something else in there about an open space committee spot.
Yep. So there's one vacant seat. There's two interested candidates. It's a joint appointment between the Board of Selectmen and the moderator. I believe the chairman's going to speak with the moderator about, the two candidates that are in front of all four of you, and we'll probably have a decision for the next meeting.
Great.
It's unfortunately, I wish there was two spots. But of course, the meetings are public and anybody can, attend and help out. My other comment. So I'm sorry, I don't have a ton, and I've been not COVID homesick, but I've been homesick for the last few days. So, but I am happy to report that we closed the RFP process for the financial software for the town hall. And we got one bid, but that bid is of Tyler Technologies, or Munis, which is the company that we were hoping for. And their bid price actually came in cheaper than what they originally quoted us. So we're thrilled to have received that, and we'll be recommending the Board of Selectmen approve the contract to them at the next meeting, and we'll be getting started on that process this summer. So
That's good.
That's great news.
Yeah, I know that Munis is sort of the gold standard for this type of work, so it's good to have them on. I tried to get them when I was there, but we couldn't afford them at the time. So, I'm glad you were able to do it.
Yeah, I was just gonna say that budget was approved at the last town meeting, right? Funds for that software.
Yeah. So we were approved $300,000 borrowing for the costs of purchasing the software and implementing it, and any training related to that. The quote for the upfront cost came in at $160,977, so about $161,000, which is good. And then the recurring fees, the annual cost of the license to use the software, $42,729. That $42,000 is about the same, if not a little bit less than what we pay for our current system. So there's a big upfront cost, and there's a huge undertaking on, establishing the software and getting everybody used to the new program. But overall, we're going to be saving money and implementing a much better process and program to manage our finances. So it's worth it. It's worth it in the end. And then lastly, I just mentioned we are officially on the sewer project. We are officially utilizing the bypass system at this point. So our old pipe from the end of the causeway to the transfer station is no longer in use. And the next step is to clean that pipe And we are awaiting the, material of the slip lining. So good news that we're off of that and onto the bypass, and we don't have to worry about, any major sewer breaks in that area of the line anymore.
Excellent.
Yeah, it'd be nice to get through a winter without any sewer breaks. So, and for those people wondering what we're talking about, so this is the black plastic pipe you see when above ground pipe you see when you're driving down the Linway. So our sewage is now flowing through that instead of the underground pipe, which will be slip lined in the coming months. Any update on the schedule, Tony?
No, our next meeting is next week, next Thursday. We ended up not meeting last week. So we meet every 2 weeks. And I'll have an updated schedule then. But getting the bypass on last week was a big milestone. And then I know the next step was really waiting. They're not going to start digging the pits until they have the pipe, the slip line pipe in stock, till they have it here. So that's really the next big step, is waiting for that to be delivered. And hopefully that's in the next few weeks. So that's all I have. Thank you, Mr. Chairman.
Right. Citizens Forum. Do we have any anything in the chat or anyone on the Zoom call that wants to unmute themselves and have a question or comment?
Hello,
Hey, George.
how are you
I
guys?
hear you. Good.
You guys had mentioned about the RNAV study. Obviously, I was a little disappointed that they even recommended this study, but I'm grateful that they did. Questions, when they mentioned the study, they said they were going to put down some noise monitors down on Long Beach, ones from the noise abatement office, and I guess some outside contractors. They're supposedly going to put one down there too. I was wondering who's going to, from the heart, who's going to monitor that and make sure they're down there. And like you had said, the only thing I think we can do about this is to call and complain. I think that it would be nice if Tony or somebody put the article that they talked about in the study they want to do for a year on the website, so people from the heart know about it, and also maybe make it a little more easier to find the number for the airport to call, and also maybe put it on the kiosk down at the entrance to the heart, basically at the end of the causeway or the beginning of the causeway, depending on which way you're coming, to let them know that the only way we're really going to hopefully have any chance of doing anything about this is to call and complain. If that's what happened with a lot of these other towns, if you research it, you can go on, excuse me, the Massport website. You can go by towns, by complaints, by numbers of citizens that make the complaints. And some of the things that stick out to me is like over in Medford, they had a lot of maybe 2,000 or 3,000 calls, but it was made by 8 people. So it's kind of strange that, 8 people were able to sway the Massport into changing these routes and stick all these flights over here in the heart, especially over in Little Heart. And we're going to get bombarded by this. And our only recourse again is to make sure that they put down the noise monitors, and we keep track of them and make the citizens aware that we should be calling the number to complain, and tell them that the planes aren't flying where they're supposed to be. Either one of the complaints, you could say missing a waypoint, turning too soon. But the whole idea is to call and complain, because that's what's driving most of this change of the approaches to this 22 left and 22 right. And also with the takeoff of runway 4 right, 4 left, which is the same runway, just depending on if you're approaching it or taking off from it, it is different numbers. So between the 22 left and right and runway 4 right and left, we're getting bombarded with the approaches and the takeoffs. And the big problem is that no one really calls and complains that much. And when you do call and complain, they don't really believe you. They tell us that the planes are flying where it's supposed to be, and they're not. And they refer to the noise monitor over at the Coast Guard station. And they tell me sometimes that the planes are 1,500 feet away from my house. And that's about the distance between my house and the noise monitor. So the noise monitor where it is right now over at the Coast Guard station is basically useless for the people over here in Little Nahant. So my request would be to make sure that the noise abatement guy, I believe that's Bob D'Amico. I'm surprised he's not here speaking for us, and I'm a little surprised that he wasn't at the meeting, this very important meeting for us over in Little Nahant. I don't know where he was, but he was nowhere to be found. So I want to make sure that, you know, we are getting a fair shake at this as far as who's going to monitor the monitoring they're going to do about these planes they're supposedly going to fly over the causeway. Thank you.
Tony, do you know what the status of these additional noise monitoring devices, Mr. Mahoban?
That's what they said. That's what they said when they talked about the study. The gentleman from Hull is the one that brought it up. Thank God for him. He's the one that brought it up to say that instead of passing this motion and getting all these planes to fly over basically Little Nahant over the causeway, he suggested that they do a study, still do the process, but study it for a year. And like you had said, Tony had spoken up. Thank God Tony was able to speak for us. And so thank God that was done. So at least we have a year to figure out some kind of plan of attack and get a little more force behind this, and a little more public attention, and maybe a little more participation from the our selectmen, and speaking up a little bit more, you know, bringing this issue so people in the town are a little more aware of it, and get that number to call, and really hit on how important it is to call that number and complain about it. Because if not, this is going to be hellacious over here. And I don't think people really realize that.
Yeah, I mean, you're right. You're right, George. I mean, there's power in numbers and getting the word out that, you know, people need to have their voices heard. And that's our best bet to exert some influence here. So I think we need to do, as you say, do what we can to get the word out, get the numbers, phone numbers out, and contact information out. It's certainly a quality of life issue for everyone that lives in Nahant.
Yes, and I have a feeling that it's going to become an issue for people over Big Nahant too, because the way these planes fly, they're not flying where everybody tells you they are. You know, they tell you that, I think I mentioned this once before, that I'm a poor judgment. How can I tell how far the planes are flying away? Well, I'm sitting on my lounge chair, look straight up and look at the belly of the plane. I don't need anybody to tell me that they're flying over my head. So again, and Gene sees it too from his spot over there, Big Nahant, looking over at Little Nahant. And from where I am and where I sit, I see all the planes that they're talking about that are going over Bedford and going up over towards Lynn and then over Marblehead and coming straight over us in Little Nahant, and then going out and clipping Big Nahant by 40 steps and so on and so forth. I've been watching this for 30 years and seeing how it's increased over the years and years and years. And Gene's right, they do follow like almost like an arrow as far as when they fly. It's amazing how if you can make a drawing of it, the line would be basically maybe 50 yards wide of where the planes seem to always fly. It's absolutely amazing. So they have the potential to fly in pinpoint areas, but the thing is to get them to believe that what they think is the pinpoint area isn't. That's my big concern, is what I call on the runway 5 right and 4 right and 4 left, when they take off, is they keep telling me that the planes are out over the causeway, out over the halfway house, and they're not. And so it's a matter of trying to get them to believe us. And I think, like I said, and you agree with, the power in numbers would maybe sway them to listen to us a little bit more. So and I appreciate all the work everybody's done so far. I just don't want it to kind of fall off the map, in other words, because it is very important to Nahant, and especially the people closer towards the area where they are flying, which happens to be Little Nahant. It's all still one town, even though they call it Little Nahant, Big Nahant, still Nahant. So again, I want to make sure that we, we're taking full advantage of these offers that they said, and someone's checking on this and making sure that the recordings are correct. They, like I said, they had mentioned that an outside vendor, so it's just not Massport putting the noise monitor down there. So, you know, in other words, you're getting two sides of a story. In other words, it's not just Massport. It's a vendor, an outside vendor, so you can check and make sure that the readings are the same. And hopefully they could tell by that maybe that these planes aren't flying where they're supposed to.
Mhm. I see that we do have on our Nahant.org website the aviation noise related link where you can file a complaint as well as the
Yep.
phone number. But the title of that page is RNAV study. Maybe we should retitle that page to, you know, be air traffic noise or something like that. And the RNAV is kind of a subset of the
Yes, like a no, I'm sorry, go ahead, Mark. I was gonna say, you can make it like a noise complaint, an airplane noise complaint, airport noise complaint.
right.
Line.
If you don't know what RNAV is, you might not find that
Yes,
page easily.
right. I mean,
Yeah,
there
so-
was 400 and some odd people that signed that petition, which I thought was great. So just want to make sure that the people that don't have access to the computers or, you know, be able to get on the Zoom calls and they don't have the computer, they could also maybe see it on the kiosk down at the end of the causeway. You know, noise, you know, airplane noise complaints, call this number, you know, run it down there for a month or so, especially in the summertime. So people get the number and they can call. It's just a simple phone call.
Hey, George, I'm not sure how this is structured, but would you want to be more involved in this?
Sure would be.
Okay, we'll give that just some consideration.
Okay. Be more than happy to.
Thank you.
All right. Thank you guys very much. Have a safe and happy new year.
Thanks.
You too.
Thank you, George. Anything else in the chat or anyone else want to unmute themselves?
Nothing else in the chat.
All right. All right. Any other last chance? Going once, going twice? All right.
Move to adjourn.
Second,
Any discussion? Hearing and seeing none. Roll call vote.
Gene Canty, aye.
Mark Cullen, aye.
Josh Antrim, aye. Thank you, everyone. See you next time.
Good night, everyone.
Right.
19th.
Yep. Good night. Thank you.